Well, I'm Dr. Rita McGuire, the Chief Medical Officer here at Wakana, one of the co-founders. And each and every Wednesday, we pick a topic, Feel free to email me. Someone emailed me and said, Dr. Rita, we want to hear, or I want to hear about how CBD can help and assist with allergies. Many of us on the line either have allergies or we know someone who suffers from allergies. So we're hoping that this information is going to help you, your loved ones, and anyone that you know. So allergy sufferers, I'm telling you, these are some miserable people, right? Millions of people experience some sort of allergy, whether it's chronic, a seasonal, it's a reaction to certain foods. Allergies can be inherited or they can be a result from the environment, like pollen or mold, or from your pet's hair, or like I said, certain foods, the climate, temperature, even humidity. Guess what? Stress can also influence the severity and frequency of allergic reactions. And we're going to find out why this evening. So there's, again, so many types of allergies, right? You can be walking through the field and walk through some poison ivy, and yes, you'll have an allergic reaction because of a skin contact with a plant. There's some folks who have latex allergies, right? They can't use certain condoms, they can't wear certain gloves because of a latex allergy. And again, we talked about animal hair or animal dander, and even jewelry. I have an allergy to nickel. Every time nickel touches my skin, I have a breakout and a rash. Certain foods cause allergies. Sometimes we call them food intolerance. One is milk. Another can be certain medications. Antibiotics certainly can give an allergic reaction. Many people are allergic to shellfish. My oldest brother was allergic to shellfish, and he used to take an antihistamine before he had either shrimp or crab. I mean, he loves shellfish so much, he was willing to risk an allergic reaction. So he would pre-medicate himself with an antihistamine. And we're going to talk about what histamines are, what antihistamines are, so that he could have some of his favorite foods. Nuts. Some people are allergic to nuts, right? They are allergic to peanuts or walnuts. There's certain medications, injectables, that can cause an allergic reaction. Certainly bee stings. I found out that I was allergic to bees in my late 30s. My daughter started cheerleading, and at one of her cheerleading practices, I got stung by a bee. I think I was about 33 years old. And what was crazy about it, it was such a severe allergic reaction that my hand was like 10 times the size it is now. It was a very, very scary event in my life. I never knew I was allergic to bees, I guess because I had never gotten stung by a bee ever in my life. But it was so severe that I had to be hospitalized and get IV steroids just to bring the swelling down. And then there's inhalation allergies, from pollen, from dust, from mold, mildew, and again, animals as well. So what's interesting about allergies is that it's very common. 1 in 4 people suffer from allergies. And if you're on the line and you have allergies, some of the common symptoms are runny nose, a nasal congestion, coughing, sneezing, watery eyes, itchy nose and eyes, worsening of asthma. So if you're asthmatic, sometimes it can trigger a status asthmaticus event, which could end a lot of patients up in the hospital on ventilators. And of course, a decreased quality of sleep. And again, in the spring, that's when we really see a lot of folks suffering, like during this time when the pollen count is high, when a lot of the trees are releasing a lot of the pollen. There are some natural remedies. There are medications, and we're going to talk about them, but nasal saline rinses, nasal steroid sprays, and even antihistamines. And when you really have issues, immunotherapy, that means you go and get these allergy shots every month or two to reduce these symptoms. But the biggest thing that we're going to talk about in addition to CBD is prevention. Trying to avoid pollen is not really that easy, right, in the springtime. But there are some things you can do in your home, like get special filters and cleaners in your home to clear the air, at least in your home. Wash bedding and clothing in hot water, that seems to help. And also shower and change your clothes frequently throughout the day, especially if you're going in and out during the springtime. Allergy testing is really big. Allergists are physicians who specialize in testing folks that have allergies and coming up with some resolution for their allergies. But the biggest issue is histamine. Histamine is the culprit for why folks who have allergies are so symptomatic. See, histamine is a chemical that your immune system makes. And histamine is like a bouncer at a club. It's actually trying to defend whatever has triggered your allergy. It's really trying to help your immune system fight off that trigger. But what's really crazy about histamine is that it absolutely makes the symptoms worse. Because when histamine is released to help defend your body from an allergen, this is what happens. It causes a release of what we call mast cells from the immune system. And these mast cells will go to the skin, they'll go to your lungs, it'll go and release mast cells in your nasal passages, and it'll start to either dilate vessels in your nose starts running, it starts to dilate vessels in your eyes, and your eyes start watering and tearing. It goes to the lungs and starts to constrict those vessels, so you start wheezing and you're short of breath. It goes to the colon, the stomach, and the bowel. You start having diarrhea and constipation and abdominal pain and vomiting and loose stools. It's a release in the body to try to defend from an allergen, but it really makes things worse, right? Many of you may have a lot of these symptoms when your allergies are really, really, really bad. From eczema to hives. And when you have all these symptoms, guess what happens? You're really irritable. You're really mean. I do know. I have a middle child, Joshua, who had really bad allergies until I introduced him to CBD and essential oils. So, they're miserable, they can't sleep, they've got mood swings, and just imagine how you feel if you're coughing and sneezing all day, right? Histamines also release a lot of inflammatory cells, which cause pain. It causes joint pain. It causes muscle ache. So along with having allergies and having mood swings and behavioral symptoms because you're having an allergic reaction, you also can have pain with allergies. Now, many of you who have allergies absolutely can identify with this slide, right? Over-the-counter antihistamines try to counteract the histamine release, right? So we'll give you or recommend to you to take Allegra, or maybe we'll recommend Zyrtec, or maybe Claritin, or Benadryl. These are some of the common over-the-counter antihistamines that we give those who suffer from allergies. Why? Because we're trying to counteract the histamine release that happens in the body as a defense. What happens when we give our patients antihistamines? What happens to you? If you're on the line and you take antihistamines, give me a shout out if you have any of these symptoms. Well, antihistamines like Benadryl makes you sleepy. Can you imagine having allergies and then trying to go to work and you've taken Benadryl and you're sleepy, you're drowsy? It can cause nausea, confusion, and blurred vision. So unfortunately, even over-the-counter antihistamines have its side effects. So let's talk about the probably most severe way of treating allergies, and that's allergy shots. Now, I don't know about you, and I am a physician, but I hate needles. Dr. Rita hates needles. I'm telling you, I do not like needles. I've used needles on other people, but getting an allergy shot, oh my God, every month, every quarter would be really hard for me. So immunotherapy or allergy shots are really reserved for those who have got no relief from their allergies from either over-the-counter medications or even prescription antihistamines. So let's talk about CBD, because CBD can be an alternative for all of you out there that have allergies. See, CBD or cannabidiol is a potent non-psychoactive cannabinoid found in the hemp plant. It's part of the cannabis family, but it comes from not only marijuana that gets you high, but it also comes from hemp. Hemp is a species that has large amounts of this CBD and very trace amounts of the part of the plant that gets you high, which is THC, and it gives one that is looking for an alternative to their allergies an option without the high. So it is one of the #1 components found in the hemp plant. It's called cannabidiol. So let's look at cannabidiol, and it may be a little hard for you to read the writing, but CBD cannabidiol has a lot of benefits. And let's specifically talk about allergies though. CBD is a very powerful anti-inflammatory. And when histamine is released, let's say you're walking down the street and all this pollen starts flowing at you, and you start to have an allergic reaction. Your eyes start to itch and your nose starts to running. Well, the histamines in your body are defending that trigger. They're trying to help you fight off this pollen reaction you're having. But unfortunately, the histamines also release inflammatory cells. So the inflammation starts to occur in different parts of your body. Inflammation, again, like I talked to you earlier, can cause joint pain. It can cause muscle pain. So CBD is very, very important when we talk about reducing inflammation, which is caused by the histamines, to be reduced in those who have allergies. CBD also is very potent as an antibacterial. Many seasonal allergies or sinusitis or sinus infections that we see due to allergies are due to a bacterial infection. So CBD is antibacterial. So it really helps to reduce that bacterial load if the sinuses in your nasal passages start to become infected. CBD also helps to reduce anxiety. I talked to you. I lived with my son for 21 years before he moved out. He was miserable. He was irritable. He was mean. Why? Because his allergies were so bad, he couldn't sleep. He didn't feel comfortable because his nose was running, his eyes were always watering. He just felt miserable. CBD helps to reduce anxiety, to help calm their mood. It also helps to sleep. CBD is very powerful in helping those pathways in the brain to release more dopamine, more serotonin, so folks with allergies can sleep. So you always have to remember that we can never, ever make claims that CBD will cure your allergies. But what we can say is that CBD absolutely can address the symptoms that you do have from having allergies. And again, those symptoms are symptoms due from a histamine release, from an inflammatory release that can cause symptoms of watery nose, itchy eyes, mood behaviors, and pain, and etc. What you also see in this diagram are other compounds that the hemp plant makes. Not only is CBD important, but CBG and CBC and delta-9 THC and delta-8 THC. All of these compounds, what we call cannabinoids, work synergistically on your cellular level to help reduce that histamine load, to help reduce that inflammatory load, to help you feel calm, to help reduce the pain. And the way it does it is through a science. See, there is a science behind how CBD can assist with those who have allergies and many, many other conditions. And it's through the endocannabinoid system. This system has receptors, CB1 and CB2 receptors, that specifically bind with CBD, specifically bind with those other compounds we talked about in the last slide to put the body into balance. And when we talk about allergies, we're talking specifically about the immune system, making sure that the receptors, both CB1 and CB2, put the immune system back in balance. See, when you have allergies, your immune system is crazy. It's hyperactive. It's like it's fighting your body. It's almost having like an autoimmune disease where your body thinks that these allergy triggers are foreign. So it's trying to fight them off, right? So CB1 and CB2 receptors are found in the immune system. They're found in the system where those mast cells, stay with me, that are releasing histamine, that can release inflammation, is put back in balance. So inflammation is addressed, the histamine is addressed, and your allergies are addressed. So again, hemp and allergies, it activates this endocannabinoid system to support your immune system. CBD also blocks the release of histamine. So instead of taking an antihistamine like Zyrtec and Claritin and Allegra that block histamine, you can use CBD to do the same thing without all the side effects, like drowsiness and confusion and blurred vision. Hemp or CBD is also a powerful anti-inflammatory and antimicrobial that we talked about, reducing the incidence of sinus infections that many allergy sufferers get. It also reduces the swelling of the nasal passages. So instead of those passages swelling and your nose is running, it reduces the swelling. Now, another thing we see in allergy patients is a lot of mucus production, right? So what happens with CBD, it opens up the sinuses and it really allows that mucus to be expelled from the body. It helps to relieve congestion and it helps to aid in prevention, again, of infection that's caused by itching of the eye. So CBD is safe. It's a natural way of addressing and alleviating an allergic reaction by reducing inflammation, by reducing histamine release, and helping you feel better. Again, there are many studies that show how CBD can help to regulate your behavior, right? We talked about how those who suffer from allergies are very miserable. They're irritable. They're cantankerous. They're crazy because they feel awful. CBD also reduces inflammation. It opens up the sinuses. It relieves all the pressure that you have in those sinuses and nasal congestion. And again, more importantly, CBD is an antimicrobial, reducing infection. So when we look at this plant, it looks so harmless, right? I'm telling you, this pollen is awful. This was the true irritator of my son Joshua. He couldn't do outdoor sports like baseball during the spring or golf because this pollen had him incapacitated. He had to stay inside a lot when the pollen levels were high. And again, CBD is able to reduce the allergic reaction due to pollen, due to mold, due to animal hair dander, due to foods, due to medications, by reducing the inflammation, by putting the immune system back in balance or homeostasis, and many, many studies have shown that it's done that. Pain management. Just imagine sneezing and coughing and sneezing and coughing. Allergic reactions can cause chronic pain. So CBD is an anti-inflammatory. We're going to talk specifically about products that you can use topically to even help reduce the pain that allergic reaction and allergies can cause. So is CBD safe? Is it a safe option? Absolutely yes. CBD can be used as an option safely to replace conventional allergy treatments, over-the-counter allergy treatments like antihistamines, without all of those side effects. We always recommend that you consult your physician, especially if you're someone out there that has really severe allergies, you're getting all these allergy shots, you're working with an allergist. Loop your allergist in with the CBD so that they understand all of the benefits that CBD can gain, that you can gain from CBD with your allergies. So let's talk about some of our products. We have some amazing products that I want to recommend for those who have allergies. Our disclaimer is that these products should not be used or sold by persons under the age of 18. We do have some vape cartridges that should not be used for persons under the age of 21. If you have allergies and you're nursing, you're pregnant, you're under a physician's care, please consult with your physician. The FDA does not allow us to say that CBD can cure your allergies or any other issues, okay? But we can direct you to the science. And we've talked quite honestly about the science, about how CBD can assist with symptoms that those who have allergies have. Now, a big question that everyone says and asks, not says, but a question they ask is, how fast would this CBD work? I need it to work right now for my allergies. Well, the factors that really impact the effectiveness of CBD really depends on a lot of things, right? It depends on the concentration of the CBD you're taking. It depends on your weight. It depends on how severe your allergies are. It depends on your body chemistry. And oh my goodness, we're going to talk about diet. It depends on your diet and your overall tolerance to CBD. So let's talk about our tinctures. Our tinctures are products that are oils. They are placed underneath the tongue. I highly recommend using a CBD tincture, one of our Wakana tinctures, for your allergies. Why? Because tinctures are able to really get into your bloodstream and stay in your bloodstream for a good 6 to 8 hours or more. So that's why we recommend twice a day dosing with our tinctures. I like to start out with 3 drops in the morning and 3 drops in the evening. It's a great way to offer relief. Our Hempranium 500 milligrams, which is here, is a great product if you have mild to moderate allergies. If you have severe allergies, I would recommend our Hempranium MD. It's our more potent formulation. It is between 600 and 850 milligrams of CBD, so it's a more potent product. We also have a water-soluble product. We have a broad-spectrum product. That's our pure product, because there are some folks out there that have allergies but may have random drug screens. You may get random drug testing at your job. So we want to make sure that you have a product as well. And that would be our broad-spectrum product that contains less than 0.0% or less of THC. Now, the legal limit of THC in hemp products is 0.3% or less. So all of our power products, all of the products that are in the black labels have the legal limit of THC. So if you do not have drug screens at your job and you have allergies and you want to address your allergies in a holistic, natural way, you want to use our power product. If you have urine drug screens at your job that are random, you want to use our pure or broad spectrum products. Our topical products, we talked about how those who suffer from allergies have joint pain, they have muscle pain. Why? Because they have an overall increase of histamines that release an increase of inflammatory cells, which can cause neck pain, headaches. It can cause back pain. It can even cause a lot of inflammatory pain in joints. So the topical products are going to offer local relief for those who have allergies and have joint pain or muscle pain. We have a 400 and 200 milligram extreme power relief. It is in a cream. You can apply it locally 3 to 4 times a day. We also have a Dr. Rita's rub. You know, I really love it, not just because it's Dr. Rita's rub, but I love the fact that it's in a roller ball packaging. So I carry my Dr. Rita's rub, and whenever I need it, I just inconspicuously go under my lab coat here and just rub it on that shoulder that's giving me a little issue. We also have our Power Body Mango Cream, because we do know that allergic reaction can be in the form of eczema. It can be in the form of a skin issue like eczema, psoriasis. So our Power Body Mango Cream is a great topical product that you can use for those hives, for those rashes. What I love about topicals is that they don't pass the blood-brain barrier. They won't make your urine drug screen positive. So if you have urine drug screens, you absolutely can use any of our topical products. We also have smokable products. Those are products that you can use when you're having an acute allergic reaction that can work within 1 to 5 minutes. We have vape cartridges. We have pre-rolls. We have premium flour that you can use. 1 to 3 pulls is all you need 3 times a day to address those acute allergic reactions that you may have during time to time. And then our edibles. You want to use the edibles at night. The edibles are gummies. They're going to help you sleep, right? A lot of allergy sufferers can't sleep because they're miserable. That histamine release doesn't allow dopamine and serotonin to be released in the brain to help you sleep. So our power gummies are great. Our broad spectrum gummies. The broad spectrum gummies, again, are those gummies that contain less than 0.0% or less of THC. So we have gummies for those who have random drug screens. We have gummies for those who do not have random drug screens. We have a product that you can bake with, you can cook with. Our Hempranium, our culinary product, you can place in your baked goods or any other foods that you're cooking. We have an immune defense tea. We also know that addressing the immune system, making it as strong as possible, will help reduce allergies as well. So we have so many great products, as well as spices. You can use CBD spices in your food. Another way to address your allergies in spices are butter. We have a vegan butter you can use as well. So there's tinctures I recommend that you take twice a day. There's the topicals I recommend that you use on local areas that offer local relief for joint pain, for headaches, for even, you know, that pain you get in these sinus areas. You can rub a little of that power relief cream here on the back of the neck. We also have those fast-acting smokables, our cartridges. We have the lotion. We have the spices and the butter. Just so many products you can choose from. But remember, prevention is the key. Prevention. Trying to avoid certain allergies or allergens are not really that simple, right? Because you got to walk outside, but there's things that you can do in your home, as well as filters. There are areas that you can talk about when it relates to changing your clothes, maybe after exposures, keeping the windows and doors shut, showering often if you're in and out during allergy season. I do want to just let you know what I did for my son, Joshua. Joshua is really happy here, right? He is a happy guy because he doesn't suffer from allergies anymore. His allergen or trigger was pollen. What did I do as a mom? First thing I did was I introduced him to our amazing products. I put him on Hempranium 500. I had him start at 3 drops twice a day. I also put him on black seed oil. You know, black seed oil, what doesn't black seed oil do? But black seed oil helps to address digestion, kidney function, immune function, inflammation. And the third thing I did is I removed dairy from his diet. I removed cheese and milk and eggs. And I'm telling you, within 6 months, my son, my Joshua, was able to go out and play golf. He was able to play baseball. He was able to really get the quality of his life back. And he did it with a combination of lifestyle modifications, which we all have to do, right? There's even certain foods that you can Google that have high histamine levels. You want to stay away from foods that have high histamine levels, but absolutely dairy causes an increase of mucus. It causes an increase of inflammatory cells, and the dairy is from the devil. So take dairy out of your diet and add these amazing products. So I want to talk briefly about essential oils, because essential oils are essential to those who suffer from allergies. But who better yet to present that information is our very own Dr. Betty Guy Smith, who is an expert in essential oils. I'm telling you, this woman is a wealth of knowledge. I want to bring her to the stage so she can share with you our amazing products here at Wakana, our essential oils that should also be added to those who have allergies. So let's see. I think I have to promote her over to a panelist.
Well, actually, I'm here.
Oh, there you are. I just promoted somebody. Somebody is a panelist that shouldn't be a panelist, but that's okay. Dr. Betty, thank you so much for inspiring us with these essential oils. And I'm just going to do this. Okay. Can you see Dr. Betty?
I can.
Okay. But can we see you? It's
well,
okay.
yes, we can see her.
Okay. You can take it away.
Okay. So thanks for this opportunity to share with everybody about our wonderful, magnificent, pure essential oils as they relate to allergies. So Dr. Rita already talked about Blackseed, which I was going to mention a little bit about. Like she said, it is absolutely essential in terms of respiratory health and helping with the symptoms of allergy, because it is hands down one of the best that's a tongue twister, antimicrobials. And so it offers a lot of assistance with bacterial, viral influences that might be experienced with allergies and the symptoms of allergies. So she already handled that. So I'll move on to eucalyptus. And just let me say that essential oils are really a safe and natural way to minimize and many times eliminate the symptoms of allergy. They boost the immune system function, and I mean, basically, they really help you feel better. So eucalyptus is an excellent choice, and as you can see, is one of our essential oils. And the benefit of it is that it opens up the lungs, and it also opens up the sinuses so that circulation is increased and the symptoms of the allergic reaction are actually decreased. It also produces like a cooling effect in the nostrils, so that it actually increases airflow, because it helps to shrink the mucous membranes. The coolness of it helps shrink the mucous membranes. And then we have peppermint, which is highly anti-inflammatory, and that is one of the reasons we added to our CBD. And so it's very soothing to many of the effects of the inflammation, because inflammation is heat, and the peppermint is very cooling. If you've ever put peppermint in your mouth, you get that burst of coolness, and you can actually feel in your nostrils that mentholated cooling effect, which helps to decrease the any swelling and increase airflow. So in essence, it really improves your breathing. It also helps to relieve that congestion. So now, a couple of the ways that you can use peppermint are to just shake a few drops in your hand, rub your hands together, and cup them over your nostrils and inhale. And boy, you will feel everything just open up, and you'll be able to, the airflow will increase. So you can also diffuse it in a diffuser. There are a couple of different types of diffusers. They're the ultra mist diffusers, where you have water that you put a couple drops in, and the water actually takes the droplets of oil and diffuses it throughout the air. Then they have their types that diffuse pure essential oils into a very, very fine mist. And that particular method is also very therapeutic. You can also, let me say, in diffusing, you do want to limit the time that you diffuse. Don't just diffuse essential oil all day long. You want to do it in increments, or short bursts of periods, like, excuse me, maybe a half an hour. You want to diffuse, and then do that maybe 3-4 times a day. And that is very helpful. Okay, you can also rub it on your chest, where your respiratory passages are, as well as up the neck, sides of the neck, and up the back of the neck. And this allows the vapors, the terpenes, to infuse into your respiratory passages as you're breathing. Okay, then we have lemon, and I just love lemon. Lemon is such a diverse, such an essential oil that has such diverse functions. It decreases. Well, I should say, first of all, it increases and supports the lymphatic system, in that it encourages drainage of those drainage of the waste, because our lymphatic system is just like a sewage system, our body's sewage system. So we want to keep those toxins, that waste, moving, so that it is eliminated from our body, which also helps to boost the immune system function. Lemon is also a natural antihistamine, and Dr. Rita already talked about antihistamines and the role that they play in the treatment of allergies. Lemon also relieves and loosens some of that mucus that she was talking about with the the increase of the allergen, you get that stuffy nose, the congestion, lots of mucus, and if it's not expelled, then it can even get a little hardened up in there, cause sinus infection, and then you're off to the races with a whole nother slew of symptoms. And so the goal would be to prevent the escalation, I guess I could say, of an allergic response or allergic reaction, to minimize the effects and thereby prevent complications of bacterial infection and that kind of thing. So lemon is a good one for that. It not only does it, again, relieve some of that congestion, that inflammation, but it loosens the mucus so that it can be expelled. It also cools the inflammation, again, that inflammation being a result of the allergic reaction, the irritation. And you can tell when the mucous membranes are irritated and inflamed because they produce mucus to try to protect itself from the irritants. Lemon also has disinfectant properties, so it is excellent to diffuse in a diffuser or place in your hands. Inhale. Also good is to put a pan of water or of hot water on, drop a few drops of essential oil in and inhale. You could even put a towel over your head and inhale some of those vapors, which is going to go a long, long way. Lemon is also good to add to your water or your tea, especially if you're drinking hot beverages, because it's going to help break up that mucus and help to expel it. Tea tree oil is our last one, and tea tree oil actually destroys airborne pathogens, bacteria, mold, fungus, fungi, whichever you want to call it. So it can help in eliminating some of those airborne pathogen, because they can also contribute to or even be the cause of allergic reactions. Tea tree oil is great to diffuse, again, because it does halt the negative effects of airborne pathogens. Tea tree oil is also very good for cleaning, as well as lemon, because we get not only those pollen, mold, mildew, and all of those kinds of pathogen can be on surfaces. So to clean with those essential oils is also good, as well as utilizing our hard surface spray to clean areas. So let me just say too that essential oils are very, very potent. They come in little bottles like this, the directions say use 1 drop or 2 drops. And most people say, oh, but that's just such a little bit, I should use more. No, more is not better. Actually, you should start with 1 or 2 drops, just as the instructions say on the bottle, and recognize that this is a concentrated form of the plant, the herb. And so with that, let's say you have 5 drops of lemon, that could be the equivalent of a whole lemon or more. So please be respectful of essential oils. Good essential oils, premium quality and organic essential oils are free of toxins, of pesticides, of herbicides, and that kind of thing, and are very high in terpenes. They have a very high frequency, and so you only need a small amount. In fact, you could literally take a couple of drops of essential oil and place it in purified water and use it as a spray. Our peppermint spray is awesome. This would be an excellent addition to your respiratory health, especially that we're we're wearing masks all the time. And I don't know about you, but when I have my mask on, I feel as though I can't breathe very, very well because the air exchange is impeded. So what I usually do is I'll take my peppermint spray and I'll just spray it on my mask, and that offers me a burst of essential oil vapor, which immediately opens up my airways, and voila, I can breathe. So that is, our peppermint spray is absolutely wonderful. It's also good to keep you alert. Dr. Rita mentioned the antihistamines. When you take antihistamines, how they make you sleepy and drowsy and that kind of thing. A hit of peppermint spray will wake you right up. So let me just say that, I said more is not better. Use a small amount. Anyone with very sensitive skin should absolutely do a skin test. Use 1 drop of essential oil to 1 or 2 drops or so of any carrier oil. You could use olive oil, you could use coconut oil, you could use grapeseed oil, and put it in an area that is inconspicuous and wait, because some people are much more sensitive than others, and different people have different allergies. So someone could, in fact, be allergic to an essential oil. So always do a skin test first. If possible, wait a good 4 or 5 hours, that kind of thing. And in some cases, 24 hours, and see that there is no topical reaction, and then feel free to use them. One last thing I'd like to say about essential oils, in putting them in your hand, always make sure not to touch your eyes. If you ever get an essential oil in your eye, do not rinse it with water. Please don't do that. Get some oil, olive oil, grapeseed oil, coconut oil, and put a drop or 2 of oil in your eye, and it will calm it down immediately. But do not use water, please. Okay, thanks for letting me share.
Thank you so much, Dr. Betty. That was great information. I think everyone now understands that, using CBD plus our essential oils in so different ways really can assist with the symptoms that allergy sufferers have. So the blackseed, the peppermint, the eucalyptus, the lemon. Lemon is like my favorite now. It used to be peppermint, but I use lemon all over my kitchen, the countertops, and lemon just picks me up. It energizes me. I personally don't suffer from allergies, but we recommend that if you do suffer from allergies, really hopefully you understand that now you can utilize CBD, you can utilize any of our essential oils, you can utilize also our different forms of consuming CBD. It can be in a tincture form, a topical form, an edible form. It can be in the form of a smokable. Just get it in your system, right? I recommend that you start out with the Hempranium 500 tincture twice a day, along with the black seed. I think those are 2 great products right out the gate to start with. And then each and every month, you can start adding on different essential oils. You can diffuse them in your home. You can, like Dr. Betty said, simply use both hands as a diffuser. Inhaling, opening up those passages. Remove dairy out of your diet. Oh my goodness. But I do want to share with them, Dr. Betty, some foods that are rich in antihistamines. I didn't realize that these foods were rich in histamines, excuse me. Avocados. I love avocados. I'm glad I don't have allergies. Shellfish. I'm glad I don't have allergies. Let me read you some more. Let's see here. Some foods you really should avoid eating if you have allergies: fermented foods, processed foods, alcohol, packaged meats, aged cheese. There are some legumes like kidney beans and chickpeas that are high in histamine. A lot of the citrus fruits can be high in histamine. So you want to make sure that you Google foods that are high in histamines, making sure you're removing dairy and adding these amazing products if you have allergies, right? This can help to get you off a lot of these medications over the counter like Benadryl and Allegra and Zyrtec that have a lot of side effects. Why not address your allergies in a natural, holistic form of using CBD and essential oils? So enough of me jibber jabbering tonight. Let's look at some questions. Yes.
Let me just say one more thing. Another thing that would be excellent for anybody that suffers from allergies is to do a detox, because we are exposed to, oh my gosh, not only airborne or echo pollution, but also, the pesticides, the herbicides. It's in the water. It's everywhere. And we have been inhaling and ingesting these toxins for years and years and years before we even knew it.
Right.
And so to do a detox would do you a world of good. And so let me recommend our bitters. And because well, I can only speak for myself. I did them, and I was going to do a Facebook, and I said, oh, this is not that bad. This is not that bad at all. So really, there are 4 different, ouch, my cat. There are 4 different flavors: sweet, salty, sour, and hot. I think the other one is, but
the other one is bitter.
Bitter, duh. And the bitters are the ones that we as Americans use the least of. All other cultures use bitters and on a regular basis. And so it let me encourage you to add that to your diet. Do that 4-day detox, and you will be so surprised at the stuff that comes out of you. Oh my goodness. So try it. You might like it.
Wonderful. Let's take some questions now. Let's see. Lots of comments. Great presentation. Thank you, Dr. Betty. Good stuff. Good stuff. Extremely helpful. Great, great, great. I think the first question I saw, can a diabetic use the bitters, and do you use the black seed oil under your tongue? And can persons on dialysis use the bitters? I appreciate the time and consideration. So, Jewel, whenever I get questions about folks on dialysis, I truly, truly love to recommend that they talk to their nephrologist, right? Because folks who are on dialysis, have a different sort of fluid restrictions, fluid concerns. So if you're on dialysis, you want to ensure that the products that you're taking will not interfere with your treatment. Black seed oil is taken under the tongue. I started my son on 3 drops of the Hempranium 500 milligram twice a day and 6 drops of the black seed under his tongue twice a day. I removed dairy from his diet, and within 6 months, he was able to have a new life. So dialysis, questions, you want to make sure that you consult with their kidney doctor. So is there a question about a tincture dose for good for children? Now, our products are not recommended for children, so it's to the discretion of the parent or guardian to start their child on our CBD tincture. So you can email me, Latrice, and if I can get the weight of that child, we can figure out the dosage. My email is ritamd@wakana.com. So it's to the discretion of the parent or the guardian. Our products are for adult use. We have many parents and guardians here at Wakana that have chosen to use the products on their children and have had pretty amazing results. Let's see. Let's look over the Q&A. No questions. Dr. Betty, you did amazing. Let's see. Just a lot of great comments. I love the nasal spray for our sinuses. And I failed to show that slide, our First Defense nasal spray. Thank you, Dr. Betty. Is absolutely. Dr. Rita, how could you forget, right? It's been a long day. Our First Defense is absolutely a great product for those who have allergies. It is a CBD product along with essential oils, a great proprietary formula that goes directly to the source, right? In those nasal passages, reducing inflammation, reducing and blocking histamine release. So yes, show that again, Dr. Betty. Our First Defense, forgive me, is absolutely going to be one of those products that you're going to use if you have allergies. Any other questions? Or if you're a guest on the line, we want to make sure that you have time to contact the person who invited you so that you can get your products ordered. You want to ensure that you have a combination, not just one thing. You want to combine the tinctures with the essential oils, with the edibles at night, the gummies at night, and any topical product and even smokable product. You want to make sure that you get your questions answered. Obviously, if you have questions that come to your mind, you can email me again at ritamd@wakana.com. Dr. Betty, you want to give me your email so we can put that in the chat as well?
Yeah, she about to finish up. Dr. Rita, I just have one question to answer. It looks like in the question and answer about the bitters.
Yes.
They said, yes. What was the purpose of the bitters? And that is to help assist to detoxify some of the waste from our body. Our bodies normally do that with the assistance of our kidney and liver. But for those who are not eating properly, that will help assist you're getting those toxins out of your intestines and colon. And just a fun fact is we have 30 feet of intestines, large and small intestines, and it may take some people about 36 hours to have that move. So just kind of be cautious and make sure you're eating 2 to 3 servings of vegetables, non-starchy vegetables, for breakfast, lunch, and dinner.
Thank you so much. Can eucalyptus be taken internally, Dr. Betty? Unmute yourself. Unmute yourself. Yes, thank you.
I tend to stay away from eucalyptus internally.
I do.
Yeah, I think it's better to diffuse it or use it topically.
Yeah, eucalyptus is a hot oil, so we don't recommend you use it internally, Robert. You can diffuse it or use it topically. When you use it topically, always remember to use a carrier oil, and also use a little test on the skin before you start rubbing it all over your chest. But do not use eucalyptus internally. And yes, Jewel, we're working on those lines on the droppers so that you can see what 3 drops is, 8 drops are, 15. But for now, Jewel, 1, 2, 3 is 3 drops. But we're working on that as well.
And let me give this little tip about the drops, because all the drops are very precious in our tinctures. And so, exactly. And so what I encourage people to do is to, unless you have a very fine sense of pressure.
Dexterity or something.
Yeah, dexterity, pressure. Put 3 drops in a spoon and drop it under your tongue. And that way you know you've got 3 drops and you don't waste your product and you don't take too much of it.
So you can actually see what you're doing.
Exactly.
I love that. I love that. Yeah, we will put a post out when the coffee will be available. There's another question about that. We'll let you know. Maybe Phyllis knows when the coffee is going to be available, but as soon as it's available, we'll let you know.
Everybody wants that coffee.
Everybody wants that coffee.
Wednesday, I wasn't there, but it was tracked to be there Wednesday.
Okay.
So don't bombard the customer service tomorrow. We'll announce it and put it on Facebook if it's in.
Thank you. Thank you. Well, have a great night, everyone. We want to thank all of our business partners, all of our guests. Want to thank Dr. Betty Smith for really giving us great nuggets about how we can utilize essential oils to assist and address our symptoms if we have allergies. Hopefully this information is good information for you now to share with your family and friends and all those that you know that suffer from allergies. We want to thank all of our Wakana Medical Advisory Board. I see Dr. Charlotte Mitchell, Dr. Crawford is also on the line. We want to thank our Chief Sales Officer, Phyllis Nash, and our Chief Financial Officer, our Director of Finance, you know who you are, Kathy Weathersby. We want to thank everyone. Be well, be safe, and we'll see you next week. Have a great night, and we'll talk later. Thank you, Dr. Betty.
Thank you.